Nursing is the glue that holds the whole healthcare experience journey together for a particular patient. Nurses, they protect and identify the needs of any patient throughout the entire healthcare experience. There are a variety of careers that you can do as a nurse. A lot of people think that if they work on a specific unit, for example, NICU or neonatal intensive care unit, that means they're a NICU nurse. They're all the same, they're all registered nurses, but they work on specific units and specialize in those specific units. You can do any of that. You can go on to grad school and get advanced degrees and do things like nurse practitioner or nurse anesthetist or a specialized nurse practitioner like a psychiatric nurse practitioner or a nurse midwife, etc. There's a lot of different ones. Our motto in the College of Nursing is to learn the healer's art. So first and foremost, we learn the skill of empathy, which a lot of students come in with a lot of empathy, but they gain more and more as they go throughout our program. We also have a lot of practical skills, hands-on skills that you learn in the labs, in the simulation labs, and then you take into your clinical practice as a student. Things like starting an IV, taking blood, giving shots, you know, those basic nursing things. And then there's a lot of knowledge-based skills too. If you mix medications, what's the reaction going to be? So you have hands-on knowledge and a lot of empathy skills. I don't know if nursing really has a similar major at BYU. One of the biggest things that makes us different is that straight from your undergrad, you can go into your profession in healthcare. There's not a lot of other healthcare professions as an undergrad that you can do that. I guess the most similar might be dietetics. They do work with patients, they do work within hospital systems as well, and they have clinicals, but not to the extent that nursing does. So it is a little bit different, but that's probably the main thing, is that as a graduate, an undergrad, you can get a job right away in nursing. Well, if you are okay with needles and blood and you love how the body works, to learn how the body works, and you love people, then this would probably be a good major for you. It's a great major as a springboard major too into advanced degrees. A lot of nurses love just staying as the regular nurse and working and specializing in their specific units, but we also have a lot of students that like to go on to different fields. For example, nurses who love to go into healthcare reform. That's big right now, and so they go on to law school after nursing. Or we have nurses that want to change the way hospitals run, so they go into administration and they get an MBA. Or they just go on to advanced degrees within nursing. So it's a great major for that as well, to do either one.